Hello, my name is Dr. Donald Frommer. I'm a gastroenterologist and hepatologist, which means that I'm interested in or specialize in everything from the gullet down to the anus and includes the pancreas and the liver. Well, obviously, when I get a case, I have to look at the information sent to me by the insurer or the lawyer involved. I have to talk to the subject and also then make a report based on my expert evaluation due to the experience that I've had in my own speciality. So that is very roughly what I have to do in medico-legal cases. Well, injuries involving everywhere in the gut, that's from the esophagus, stomach, duodenum, small intestine, the large intestine, the liver, and the pancreas, and generally what goes on in the abdomen. When I graduated, I had to decide what I wanted to specialize in. And basically, after going through a number of different specialties, I came on to choosing gastroenterology because there are so many organs that are involved in it, which you can research and specialize in. And as for the subject that I'm specializing in, I've never regretted it. And in addition, it involves endoscopy and colonoscopy. In other words, looking at the upper part of the gastrointestinal tract and the lower part. It involves using your hands, and I really enjoy that. Well, I see three main categories of patients. First of all, quite commonly, people who are injured are put onto a number of drugs, mainly for pain, but also for other reasons as well. And these quite often have side effects involving the gut, such as, for example, constipation. Then there are another category of subjects where the abdomen has been directly involved in injury, and that affects the organs inside the abdomen. And another category of subjects that I see is that they have put on weight, generally because after the injury, they can't exercise as much as they normally would. So they put on weight, and this it can also have a variety of side effects, some of which affect the gut. Well, I see apart from the fact that there are road traffic accident victims, I see people who have been involved usually in injuries at work because they claim, and often quite rightly, that is a work-related injury. Try to give referrers a report which is quite detailed and which sometimes I see other reports from other specialists which don't always have enough of the details that I think are necessary to help me make a completely useful report. Secondly, I think I have a pretty good record of getting in my reports in time, usually within 10 working days. Occasionally, I cannot do that because I haven't been sent enough information by the referrer, and therefore there is very occasionally a delay due to the necessity for getting more information. And lastly, I think that the ability to go back to my own personal experience, I think some referrers find this particularly helpful. I often get people who feel that they've been through a medico-legal process where they're treated as a case and not necessarily as a person whose lives have been very badly affected by their injury, or they claim to be their injury. And whether or not my report vindicates what they say, I want them to feel that I really sympathize with what they've been going through, both the direct effect of their injury, but also the rather wearing process of undergoing medico-legal claiming. And sometimes I've had even a few persons crying when they're claiming or explaining their frustration in getting the doctor's appointments and possibly investigations that they feel that they need. And I feel very strongly that they need to feel that I do understand the difficulties emotionally as well as physically that they're going through. I think the main thing that I think I can do is that every now and again, when I see a person or have to give a report on a person, sometimes without seeing and examining them, is that I feel that either further investigations or further treatment changes would be worth being carried out. And so what I do in some of my reports, which to be quite honest, I've not seen it in many other doctors' reports, is I suggest changes which I ask the referrer to pass on to the GP. So, for example, try increasing the dose of drug X or Y, or get some more blood tests done to check whether a person's got a certain condition which may bear on the person's case, or maybe they should try out a particular kind of treatment. And I think that occasionally this might be useful for the patients, because I feel I have a duty, an ethical duty, to try and help the person if it's within my power.